Hello, and welcome to Your Health, Wealth, and Happiness. I'm your host, Brittany Maxwell. Today we have Dr. Sadiq with us to discuss an issue that affects so many people in their everyday lives. We're talking about heartburn. And on top of that, we're talking about the more severe and chronic causes of heartburn, acid reflux and GERD.
Thank you very much, Brittany, for having me here today. You were right in saying that this problem is widespread, and I hope that people will learn something from today's conversation.
I know there are audience members out there who have a burning question about this topic. What is heartburn?
Actually, heartburn is a misleading term because it has nothing to do with heart. But the way the person has pain, the area it is really pain is here, so people start calling heartburn. But it has nothing to do with heart. Our esophagus is a long tube which is connected to the stomach, and acid gets pumped up into the tube. That's where the problem starts.
It sounds like they could cause someone a lot of pain. Should someone be worried if they start to experience heartburn?
It is actually, heartburn itself is fairly common. A lot of people get it on a daily basis. At the end of esophagus, there, I'll show you the diagram. This is stomach, and the esophagus is connected to the stomach here. This junction is known as LES, lower esophageal sphincter. This is usually tight. When we eat food, the food comes in the stomach and this becomes tight. But if it's not tight enough, this acid goes back into the esophagus, and that's where it irritates the tube, and that's where you get the uncomfortable feeling first, and then heartburns and the reflux, and then all those problems start. This is the problem area where we have to worry about.
Well, with it being such a common experience, it sounds like it could become a serious issue for people. So to put our audience mind at ease, could you explain what are some everyday causes of heartburn? How common is it exactly, and what should people expect when they do get it?
It's very common. A lot of people get it on a daily basis, and the most common cause of this problem is stress. So most of the stress is the number one cause, but then obesity is another cause. Pregnant women does get this one. Sometimes people get this constipation, and the chronic constipation that also causes the problem. Overeating is the problem. Some medication does it. They produce extra acid in the stomach. So those are the problematic things which can cause reflux.
However, I know even though getting occasional heartburn, there are some cases that are more serious. What are some more details that you can go into for us about those type of cases?
20% of the American gets heartburn on an occasional basis. So it's all right, once in a while you get the heartburns, but sometimes the people start getting these events more frequently, everyday basis. That time we need to bring them in. They should see the doctor.
Well, if acid reflux and GERD are so closely related, could you help us understand the difference between the two of them?
They actually have the same symptoms. Mainly the burning feeling is the same, but when the patient start having swallowing problem or persistent cough or wheezing, it means the reflux is more. So that we call gastroesophageal reflux disease. It means that there's a more now, the symptoms are more severe than only like once in a while they get reflux. Like I get reflux sometime when my day is like really hectic. I'll get a reflux, so I know I'm producing acid now. So what I would do is just calm myself down. I will just relax or meditate for 5-10 minutes. That's a reflux. But if it's having every day the symptoms and nothing is helping, then it's a problem.
If a person's heartburn progresses to a point where it becomes that severe, as you said, should they contact a doctor for treatment, or is there still a way that they can prevent it themselves without seeking professional help?
If the symptoms are infrequent and it's not a big deal, it's all right. They can learn how to deal with their stress, and they learn how to do little things like yoga or praying or meditations or exercise. find a way how to deal with their day-to-day stresses. But if not, if they are having constant symptoms, they must see the doctor, because then they have to find out what the cause is, because there can be other causes which can be looked upon, which the doctor can advise them. That's even how to use the over-the-counter medication, and how there are some prescription medications available. So they need to seek professional help.
It seems like this would be a great first step for someone experiencing acid reflux or GERD on a regular basis. You mentioned eating fried and fatty foods, but I know there are a handful of things that a person can consume that are specifically associated with acid reflux. Are those things more specific that you recommend people avoid to decrease that risk of acid reflux?
Yeah, some of the food they produce a lot of acid when we consume, like onion, also coffee, chocolate, alcohol. Also sometimes tomatoes are doing increased acid production in stomach. Also carbonated liquid, some of the peppermint also does it. So all the fun stuff.
I was gonna say, what's there left to eat?
We can eat, consume, but very carefully and little. But if a person is having some symptoms, they should avoid.
It's moderation.
Yeah, moderation is the key.
Well, if the problem still remains after a person curbs their lifestyle and diet, what are the next steps that a person should take?
Again, I even earlier said that at the time when the symptoms are very frequent, they must see the medical help, because the doctor will guide them whether they should go to gastroenterologist, because this whole thing needs to be looked upon. What is the reason? What is the cause? Because there are some medications which are over the counter, some medications are prescription medications which are H2 blocker and proton pump inhibitor. They can actually further help in reduction of acids. So time comes, then we have to see medical advice.
Are there any other medications that you would recommend, or even home remedies that a person can try?
Food is very important. So when I say food is medicine, so take food which can help you. Even when the symptom starts very little, like if they are infrequent reflux, you are having infrequent heartburns, you are having, so at that time consume more yogurt, consume more milk. Turmeric is very helpful. I usually tell people, take a hot water, put some turmeric, put some teaspoon of honey, drink it. It will relax you, it will help you, it will help your stomach.
Well, it sounds like our audience and I got a better understanding of how to deal with acid reflux and GERD. With my final question here, can you please briefly go into what happens to a person if they don't take care of themselves properly?
I think it's a very, very important question you ask, and I must say to everyone, it's a very simple disease. It's not a big deal. We can take care of that. Patient can take care of themselves. Only we have to just be careful. If the symptoms are mild and they can take care of that. But if symptoms are persistent and they are not getting better, they must see the doctor, because there is more to it. If there is constant regurgitation or constant acid coming up in the food pipe, esophagus, it changes the lining of esophagus, and that we call it Barrett's esophagus. So sometimes they say that this lining now looks like more intestine than the esophagus. So that Barrett's esophagus is not very, very, very common, but it can happen. So we have to really be very careful. Only very small percentage of people who have Barrett's esophagus, they can also develop esophageal cancer. So we have to be extra cautious. If these symptoms starts, please watch these simple symptoms. First, if you want to take care of yourself, you can try over the counter, but I must say that you see the doctor. It's very, very important.
So acid reflux and GERD should be taken very seriously, and it's important that people are informed about what exactly is happening to their bodies. I believe now we took some big steps in spreading that information here today. I want to thank you, Dr. Sadiq, for coming here today to help me learn and among the audience about acid reflux and GERD.
Thank you for having me. I'm so happy that we can talk about this topic today, because it's very simple. It can help a lot of people, and I'm hoping somebody there out there will learn from that. Thank you so much for having me.
Stay tuned for the next episode. Until next time, stay healthy, happy, and live better.